Good afternoon, ladies and gentlemen, and welcome to this new segment of Medcast. Medcast is a TV program that is focusing on the latest medical trends and replying to the rumors in the society. If you are interested in your health and if you want to know your health better, please be with us in this episode, which we are honored to have Dr. Abeer AlAli. Dr. Abeer AlAli, she is an ENT surgery specialist and she is specialized in pediatric ENT. Welcome again, Dr. Abeer.
Thank you so much. Thank you for having
We
me.
are so grateful to have you again here in Medcast, and hopefully we have you more and more.
Inshallah, hopefully.
Dr. Abir, this time we need to discuss something that is probably new to our society, and I think they have never heard it about before, which is
Mhm,
the microtia. What is
mhm.
microtia exactly?
Microtia actually is a deformity of the external ear,
Mm-hmm,
which is composed of the pinna, or what we call the auricle, or the external auditory canal. So we could have either just the auricle
mm-hmm,
or the both of them together, the auricle and the external canal. And this is a deformity that could be present in a sporadic form, like isolated. So it means that the kid just has one deformed ear.
mm-hmm.
But if sometimes they're bilateral, meaning both sides, this means that it could be part of a spectrum or a genetic disorder or a syndrome that needs to be, addressed differently.
So can that deformity affect the individual?
Yes, absolutely.
How?
So obviously if the kid has both of them, bilateral microsis, that means that the kid has very poor hearing
Mm-hmm,
and will need to very soon, early in life, in a few days of life, intervene and try to help the patient hear by establishing the diagnosis first, make sure that there's no underlying, other congenital anomalies, no syndromes, and that we try to rehabilitate hearing by
mm-hmm.
using hearing bands, what we call the soft band hearing bone conductive hearing aids. For the kids who have only unilateral, meaning one ear that is deformed, usually I do reassure the parents that the baby at the end of the day will be able to develop normal speech because he has another normal functioning ear. After that, obviously we have a pathway for those who have only one-sided ear deformity. We do have to rehabilitate it also as early as 3 to 4 months by using also the soft band hearing aids. And then when the kid reaches around 7 years, then we could also discuss the potential of doing corrective surgery, which is mainly cosmetic and it's mostly done by the plastic surgeons, which it is basically trying to create somewhat
The
an
shape.
external ear.
Yeah,
And there are several techniques that we use for that.
that's great. Now, is there any like clear causes for the microtia?
It is a mutation, usually a sporadic
So
mutation that
it's
occurs.
only hereditary.
It's not hereditary, it's
Yeah.
a
Oh,
mutation.
okay. It's a mutation. It's
It is
not
a
hereditary.
mutation
Yeah.
that if it's a unilateral, one-sided.
Mm-hmm.
I've seen a lot of kids here in my clinic that there are otherwise normal babies. The parents are normal, they don't have any issues. The kid is only born with one deformed ear.
Mm-hmm.
And there are no other congenital anomalies, meaning that the brain, the heart, the kidneys, everything is normal in that child.
Mm-hmm.
However, if it's bilateral, then there is an underlying syndrome or other congenital anomalies that are associated with it. So it's part of a disease.
Oh, that's great because some people say it is hereditary. If the parents are having the same problem, they would have
If
children
there's
with the same.
syndromic, yes,
Yeah.
obviously it could be hereditary, meaning that it's part of a syndrome that they could be transmitted to
So,
the
so I
kid.
think we as a pharmacist are away from treating that
Oh no, there's
malformation.
nothing to do medically,
There's nothing to do
obviously.
with the
No, no,
medications. And
yeah.
as you mentioned before, that the treatment options could be the rehabilitation, and also the patient might need
Corrective
a surgery,
surgery,
corrective
yes.
surgeries, and also the plastic surgeons might be included in the process to have a new shape of the external
Yes,
ears. Yeah.
yes.
Now, how quick you normally advise the patient to have the intervention? As you said, and I heard you said once the baby or the child is around 7 years old, if he's having unilateral, is it?
Yes.
And if he's having bilateral, would you recommend the intervention becomes earlier than that age?
No, it doesn't matter. The fact we usually the cutoff is 7, 6, 7 years old is what we actually need is for the ear to reach its final shape.
Mm-hmm.
If it's a unilateral, meaning that there's another ear, so that the shape is the final position, so that we could do like a template,
Mm-hmm.
so that we could like copy that ear and use it for the other ear. So we could have somewhat symmetrical ears, or let's say a symmetrical shape. For those with bilateral, usually, to be honest, I've never seen that in practice doing bilateral microtias, because usually, again, it's part of a syndrome and it's quite difficult. So usually they stay with the soft band hearing aids.
So do you normally use as well the prosthetic ears?
We could obviously, there are prostheses that could be used. Absolutely,
That's
yes.
great. Now, if the patient is having that deformity, will that affect the speech and becomes late in speech?
Yes, if it's bilateral, definitely,
Hmm.
without hearing rehabilitation. However, if the baby has single-sided microtia, the speech will develop normally, but the patient will not have 100% normal hearing, because we need both ears
Yeah.
to locate where sound is coming from. So, and also when we have noise, both ears function better so that we could filter the noise from the environment and, have a good comprehension of the speech and the surrounding. However, if there's one ear, the baby still will be able to develop. And I've seen a lot of kids having one-sided microtia. They have excellent speech development. However, I do still advise to rehabilitate the bad, or let's
Hmm.
say the microtic ear, so that they could have a better awareness of the sound and the environment around them.
So please first accept my apologies if I am repeating that question
No, no,
again,
it's
but
fine.
I have never, or I wasn't actually focusing with your answer. If you have mentioned, if that problem is, let's say, clearly shown, and if it's a deformity, can we see it on the child since birth,
Yes.
or then we just need to wait later for the full growth of the baby?
Yes, but again, what I usually do is, of course, the baby, as soon as they're born, we
Hmm.
could see this deformity. However, I don't do anything except surveillance to check on the normal ear,
Hmm.
because I want to make sure that the normal ear stays normal and that the hearing is always okay. Because we know that kids do have secretory otitis media, they could have effusion, they could have repeated infection. So I need to make sure that the normal ear stays normal. And then once we reach the age of correction, meaning 6, 7 years
Yeah.
old, at this point in time, I request a CT scan. And if the CT scan is favorable, in terms of anatomy, we could create an external ear canal, meaning the hole that we see in the ear. And that also helps with hearing, but sometimes the CT scan findings are not favorable, meaning that there's a lot of deformities even inside the temporal bone, and therefore creating a canal is problematic. However, we can still create an ear
Hmm.
using the external ear by the help of the plastic surgeons. They take usually a rib graft, so and they could do that, or there are other options now, which is MedPore. It's an implant that they implant. Again, it's a surgical procedure as well, but also we have two options for that: either an implant or a rib graft.
Now, the repeated question always with a pediatrician, how would you understand a child or a baby if you want to diagnose a baby? Like if in terms of this problem,
Mm,
if the patient is not hearing very well,
mhm.
how would you know that the patient is not hearing very well?
We have
Hearing tests?
hearing tests. We have two types of hearing tests: behavioral and non-behavioral.
Hmm.
Behavioral meaning that we put a child in the room, and by conditioning, we put, sounds and lights and toys, and we could see his reaction
Yeah.
and then understand that the kid is hearing. Babies, such as newborns, and especially those who have global developmental delays, syndromic, whatnot, we could also do hearing assessment by using what we call ABR, which is auditory brainstem potentials, and this is considered a non-behavioral test. So we don't need the kid to do anything, actually. We need them just to sleep.
Do you like try to notice if there's any reaction when he hears something, or sometimes, you
No, no,
know,
no. This is an electrophysiological assessment.
so it's like there's a
So
reading for the
exactly.
results, yeah.
So we put electrodes, and it measures the hearing.
Yeah, Dr.
So
Abeer, we are so glad to have you again.
thank you.
Hopefully, we can see you again in our
Inshallah.
TV program, Medcast, and we discuss another uh, recent updates about the medical issues we have in the society.
Inshallah.
Thank you.
Thank you.
Dear viewers, we have reached to the end of our today's segment. Hopefully, we can see you our next segment with a new medical professional or specialist. See you again in Medcast.